Right now, 5 o'clock, more than 35,000 doses of Pfizer's booster shot are in the arms of Hoosiers tonight. The state health department says that total includes doses administered between last month, when the CDC approved the shot for immunocompromised folks. And now this comes as fewer Indiana counties are at the highest risk for COVID-19 spread. Check out the state health department's latest map. You see it here. That's the one on the left. Last week's map is the one on the right. So 13 counties are in red. That's down from 25 just last week. 75 counties in orange, the next highest level. 3 more counties are in yellow and none are in blue.
COVID-19 testing is again a top priority for the Indiana State Department of Health. 7 sites will move around the state to help keep hospitals from overcrowding and hopefully prevent another winter surge. News 8's Demi Johnson has more from the pop-up site at IMS.
State Health Commissioner Dr. Chris Bach says although COVID-19 cases have been trending down for the last 3 weeks, the need for testing remains high, especially with flu season fast approaching. The stage is set and the plan of action in place.
I would say the virus is not done with us yet.
The hope from health officials is that more mobile testing and vaccine sites could keep Hoosiers from being hospitalized.
Do I expect the caseloads to get as high and as bad as they have been in the past? God willing, no, that won't be the case. But what I will say is we will see times where this will elevate and go back down.
Right now, the state's data is trending down. So why is there a need to ramp up efforts? State Health Commissioner Dr. Chris Bach says cases are still running higher than last year, and that's bound to put stress on hospitals.
And that will probably continue as we go into flu season. A lot of Hoosiers have put off getting the routine health care that they needed and the routine screening exams. And so now we're seeing surgeries associated with cancers, and we're seeing heart surgeries being done and orthopedic cases that have been put off. That will add on to the fact that we will have COVID ongoing and we will have influenza season.
The state is already providing relief to healthcare workers by placing 5 teams made up of 10 National Guard members in crowded hospitals. Here in Indianapolis, they're stationed at St. Vincent Hospital. Dr. Bach says teams have also been deployed in Evansville, Jeffersonville, and in northwestern Indiana.
They are there for 7 days, and then we are reassess at 7 days for the additional 7 days.
Dr. Bach says clearing up space in hospitals will ultimately come down to more people getting their shot. With 95% of hospitalizations being in people who are unvaccinated, she says the trends should be telling enough.
That is how we are going to change in the long run what this looks like for next winter and for the spring.
This clinic started last week and goes through the end of October. It's open from Tuesday to Saturday from 11 until 8. Reporting in Indianapolis, Demi Johnson, Wish TV, wishtv.com, and follow us on Facebook.
Demi, thank you. Dr. Bach says she continues to see vulnerable populations not getting vaccinated. She's particularly concerned about pregnant women. Bach says data clearly shows COVID-19 is associated with more severe disease in people who are pregnant than those who are not. She also says that COVID-19 increases the risk for stillbirths and preterm births. Bach says pregnant women with COVID-19 are twice as likely to be admitted to an ICU and 3 times more likely to be placed on a ventilator.
The COVID-19 vaccine is safe to get if you are pregnant. Please do not put yourself or your baby at unnecessary risk. Our goal would be for all women of childbearing age to get this vaccine before they become pregnant so they are protected from COVID when they become pregnant.
Bach also stressed the COVID vaccine or any vaccine does not decrease a man or woman's fertility.